where we can, we try to optimize for outcomes-based pricing, which is we want to deliver results. Sometimes that's really hard for a buyer to get their head around because they're not used to outcomes-based budgeting today. They're used to human labor budgeting, which is hourly budgeting. If there's a customer who wants to make sure that a prior authorization status was completed or a pre or post infusion call was completed, you pay for the completion of that, not just an attempt to do it. Now, that's very different than when you have humans doing work because you're paying for time, regardless of outcome. In certain circumstances, you want time-based pricing. In the circumstances, you want outcome-based pricing. And what we have found is, by and large, in the back office, you want outcomes-based pricing because you want the system to be as efficient as possible, right? If there is a way to get data digitally over an API and get it back to somebody between a pharmacy and an insurance company, you want to optimize for that. But if you're paying for time, well, then even if I could get the data digitally, I'm going to make a phone call, or I'm going to be incentivized to make a phone call and make that phone call as long as possible, which isn't serving the ecosystem well. It isn't serving the patient well because it's delaying when they get the information they need.
Yeah.
Right? In the back office, we find having an outcomes-based model is better aligned to everyone's incentives. We started from an outcome-based perspective because I'm a big believer that if you can drive the right outcomes, everyone's incentives are fully aligned. Now, the reality is, if you charge for outcomes, the per unit price might be higher than the time-based pricing because you don't succeed 100% of the time. For the first-time buyer who doesn't know the expected outcome rate, that might be a hard pill to swallow, even though the end result might be better than what they currently have. And so that's a discussion we have. And in some cases, you go on a time-based model for some period of time to benchmark everything, and then you move to an outcomes-based model. At the end of the day, you want your human resources to work on things that humans should work on, and you want AI to work where AI should work.